I'm Katherine Mast Hagemann. I live in Tampa, Florida, and I'm a registered nurse at Moffitt Cancer Center. So I live with my wonderful husband of 4 years. We have no human children, but we have 2 bunny rabbits at home. When I'm not at work, I'm probably taking photos with my husband. We are freelance photographers on the side. So I was always interested in the healthcare setting, mostly because of my dad. My dad is a physician, and he always sparked that interest in me from a really young age. He was teaching me the parts of the heart in like 1st grade. After doing that, I was like, yeah, I need to become a nurse for sure. So I work at our malignant hematology outpatient clinic. I primarily support Dr. Andrew Kirkendall, and we see hundreds of patients every year with ET, with PV, with myelofibrosis. My role is pretty specific to patient education, and so I do a lot of educating people about medications that we're recommending, how to access those medications, side effects to expect, how to manage those things. MPNs weren't always considered cancers. They were reclassified, I think, in the early 2000s as a malignancy, but we don't always view them the same way as a lot of the solid tumors or even acute leukemia. And helping patients understand that and cope with that and learn to live despite that is one of the most rewarding parts of doing what I do. One of the things that people appreciate the most about having a care team that really understands a rare subset of diseases is just that we have the ability and experience to provide insight and education and recommendations that are really, really specific to them. And not just to their life goals, but also to their disease. We have some patients who are completely asymptomatic versus some patients who have really aggressive disease, and they're managed completely differently. Their experience is completely different, and understanding that this is more of a spectrum can be helpful for both provider and patient understanding. I like working with the MPN population specifically because I get the opportunity to follow them over a long period of time. And I think that patients really like that too. They see a familiar face every time they come. That can be comforting for people. It's great for continuity of care and fostering trust. One thing about photography, if you're in front of a camera, it's pretty normal to feel vulnerable, and so making people feel comfortable is huge. Same goes with patient care. I've gotten a lot of positive feedback from patients. They really appreciate the emotional support that I give them. I really try to put myself in the shoes of someone dealing with uncertainty and anxiety of a new diagnosis, and that's something that I know can be really, really tough to deal with. And getting as much emotional support as possible, I think, can just make a huge difference. When patients express gratitude and positive feedback and appreciation, it's a feeling that's tough to describe. Yeah, it just warms my heart.